Here to talk about issues raised by the Sturgis Rally and other pandemic developments is CBS News Chief Medical Correspondent Dr. Jon Lapook. Jon, thanks for joining us. I wanted to start with this argument that the death and infection rates are so low, such a small percentage of our population that, they don't warrant mask mandates or vaccines. Isn't what's at stake here the healthcare system at large? I mean, doctors, staff, nurses, PPP. I mean, you were telling us it's harder now than it was a whole year ago.
Yeah, I mean, I will tell you, this last week, I have spent hours every single day answering questions from people because in a way it was easier psychologically a year ago because we knew what to do, which we stayed home, we didn't see anybody, we're just hunkered down. Now, the questions are, can I go to a wedding? Can I go to a ball game? Can I go to a restaurant? Indoors, outdoor, mask, no mask? What about my kids? I have a trip to Iceland. Somebody called me about
What do you
yesterday.
tell people?
Yeah.
And I say, okay, first of all, big picture. A year ago to now, we're a lot better now. So we have this amazing vaccine. We know from the aerosol scientists, which is so important, about the importance of ventilation. Why is that important? Well, a year ago, I was wearing a mask outdoors. Now, I know if I'm a distance from people outdoors, I'm fine. It's like infinite dilution out there. We know that masks are important, that they work, they're a therapeutic. So we're different now than a year ago. But in terms of the nitty-gritty of what you do indoors, it depends on where you are and what your risk tolerance is. Because if you're in a place which is hot and you go indoors and you're vaccinated, remember that the advice back in May was you didn't have to wear a mask, right? Back then, Delta was 1%, and we thought that if you got infected, if you did get a breakthrough infection, there wouldn't be enough virus in your nose in order to spread it to somebody else. Now it's more than 90% Delta. We know from the outbreak in Provincetown that, in fact, you can get a breakthrough infection and have enough to probably spread it to other people. And so you have to make the decision, okay, where am I? If I'm at home with somebody who is immunocompromised or somebody under 12 who can't get vaccinated yet or somebody who's older, then I could potentially get infected there and bring it back to them. So, belt and suspenders, wear the mask.
Can we talk about that group? Because right now the largest vulnerable group is vulnerable involuntarily because they can't get the vaccine. That's kids under the age of 12. When does that happen?
We think that that's going to happen probably sometime in September. And, the issue of kids, we're evolutionarily wired to protect kids, right? I mean, a person will go into the street and risk their life to save a 5-year-old from getting hit by a car and who they do not know. And yet, somehow, we're not all coming together and rowing in the same direction about protecting kids under 12. You're exactly right. They can't get the vaccine yet. We have to do extra steps in order to protect them.
I think one of the other questions you talk about extra steps is the idea of whether you call it a supplemental or a booster shot for the immunocompromised. Where are we when we might see that as well?
Well, the FDA is not waving me off from the idea that I floated that next week we may get advice about people who are immunocompromised, whether they should get another shot. Because we know, we did the story here, that people who are immunocompromised, for example, you've had an organ transplant, you're on Cellcept or some other immunosuppressive medication, and you get the vaccine, you may not have as robust an immune response. And we're showing that those people, in fact, probably do need to get another shot. So stay tuned pretty quickly.
Very quickly, we got to go. But the latest numbers show that 18% of the population will not get a vaccine under any circumstance. If 18% of the population does not get vaccinated, can COVID be beat?
Absolutely, because we beat epidemics before there were vaccines. It was called getting infected, right? I mean, this is so infectious. If you don't get a vaccine, two things are going to happen. You're going to get a vaccine or you're going to get COVID. Those are the odds.
You may have more loss of life.
More loss of life, and you get infected people who are immune, and then you have people who are vaccinated and immune.
Doctor, thanks. Good to see you.